Hello, and welcome to part 3 of this series of mini lectures on IRB basics. In this final lecture, we'll describe the ethical and regulatory framework surrounding the conduct of human subjects research. So far, you have learned what an IRB is and when IRB review is required. Next, we're going to talk about the ethical and regulatory frameworks in which human research is conducted. First, we'll talk about the Belmont Report, which sets forth the ethical principles that guide research involving humans and underpin our regulatory framework. The Belmont Report was published in 1979 and was commissioned by the government in the wake of some high-profile cases of unethical research, including the Tuskegee syphilis study. The Belmont Report has two main parts. The first distinguishes research from practice, and the second defines three moral principles that should guide research involving humans. Three principles are respect for persons, beneficence, and justice. On this slide, I have pulled quotes from the Belmont Report that illustrate each one of these principles. I recommend reading the report if you get the chance, as it's not very long. But at the very least, take a moment to pause the lecture and read these quotes so you can get a sense of how the report is written. When you're ready, continue the lecture to learn more about each principle. First, respect for persons. Respect for persons is predicated on the belief that humans are autonomous individuals who are entitled to control over what they do and do not want to do. One way to think of the principle of respect for persons is that humans should never be seen merely as a means to an end, but rather as an end unto themselves. Or, put more simply, as my favorite author would say, evil begins when you start treating people as things. In addition, the principle of respect for persons extends beyond the idea that autonomous decision-making should be respected, but also recognizes that some people are not, for one reason or another, fully capable of autonomous decision-making, and therefore are deserving of extra protection. Next, beneficence. A basic approach to the principle of beneficence is a utilitarian one. Researchers should seek to maximize possible benefits or good outcomes and minimize the risk of harm, keeping in mind that harm is more than just physical. It can be psychological, economic, social, or emotional harm. But in the Belmont Report, the concept of beneficence goes a couple steps further and says that we shouldn't stop at simply doing no harm. We must actively do or promote good. Finally, justice. The idea of justice being an ethical principle that underpins human subjects research regulations may seem strange until you think about how human research was typically practiced before the report. More often than not, specific vulnerable populations were targeted for research which ultimately ended up benefiting other populations. In the Belmont Report, this principle is approached from the concept of distributive justice, specifically the fairness of distribution of benefits and the fairness of access and opportunity to receive benefit. That is, people should not be unfairly targeted for research which will not benefit them, while at the same time, people should not be denied access to research that may possibly benefit them. When it comes to justice, it is also important to understand that fair is not the same as equal. It may be necessary to target a specific population for research, but this must be justified by the study's aims, and if this occurs, the benefit should go back to the individuals who participated and/or their communities. Now that you know what our ethical principles are, it's important to be able to apply them to a specific research scenario so that you can understand how to apply them when developing your own research study. Let's apply what you just learned about the Belmont principles to a common research scenario. Pause the lecture for a moment to read the scenario and consider whether Dr. Noble's study design violates any of the Belmont principles, and if so, which one or ones. Yes, indeed, some of our Belmont principles are being violated. When I designed this case study, it was with the idea that respect for persons and justice are specifically violated in this case. First, justice is violated because Dr. Noble proposes to recruit only from her own classrooms. This means she is targeting a specific population out of convenience rather than out of scientific need. Justice compels researchers to recruit subjects equitably, so in restricting recruitment to her own classrooms, Dr. Noble is violating the principle of justice. Respect for persons is also violated when Dr. Noble approaches her own students directly and offers extra credit. Given Dr. Noble's position of authority over her students, when she directly solicits their participation, she is introducing a significant risk of coercion or undue influence. This is compounded by her offering extra credit for participation. Respect for persons requires researchers to respect autonomy by reducing the risk of coercion and undue influence as much as possible. So how might this research plan be fixed so as to follow the Belmont principles? Well, Dr. Noble could open up recruitment to students outside of her classroom, and she could rely on more passive recruitment methods such as putting up flyers or sending out email invitations on the Telegram or on listservs. She could also use a proxy to recruit students in person, such as a graduate student or another colleague who does not have a position of authority over the students. So how do the Belmont principles relate to the regulations for human research? The principles of respect for persons, beneficence, and justice are ultimately codified in the federal regulations for conducting human research. On this slide, you'll see some of the basic requirements outlined in the regulations and how they are supported by each one of the Belmont principles. When you are designing your research project, you should always keep the Belmont principles in mind and consider how to design your research study in such a way as to align with those principles. Let's talk more about the specifics of the federal regulations. There are a few different sets of federal regulations that may apply to human subjects research. These are all found in the Code of Federal Regulations, which is what CFR stands for. The regulations at 45 CFR 46 are the regulations put forward by the Department of Health and Human Services, which is the federal agency that houses the Office of Human Research Protections, or OHRP. Think of these as the default regulations that apply to all human research conducted at VCU unless another set of regulations apply. 45 CFR 46 is divided into 4 subparts. Subpart A details requirements for IRBs, including its function, the requirement for membership, and the requirements for record keeping. Subpart A also addresses requirements for informed consent. Subparts B, C, and D are additional protections for vulnerable populations, including fetuses, neonates, and pregnant people in Subpart B, prisoners in Subpart C, and children in Subpart D. This set of regulations is also known as the Common Rule, so named because after the regulations went into effect, many other federal agencies adopted the exact same regulations so as to ensure efficiency. However, some federal agencies did not adopt the Common Rule. Most notably, the FDA has its own set of regulations for human research, which are located at 21 CFR 50 and 56. These regulations are largely the same as the Common Rule, with some key differences due to the unique nature of conducting research on FDA-regulated products, such as drugs and devices. VCU will only apply the regulations at 21 CFR 50 and 56 if the research studies FDA-regulated products. Finally, there are some other federal agencies besides the FDA that have not signed on to the Common Rule and instead promulgate their own regulations for human research, such as the Department of Justice. These regulations that the DOJ have are again very similar to the Common Rule, but have key differences. VCU will only apply these regulations to projects that are supported by these federal agencies through grants or other funding mechanisms. Thank you for viewing these 3 mini lectures on IRB basics. As you develop your project, do not hesitate to reach out to the IRB office for consultations and assistance. You can learn much more about these topics on our website, and you can contact us using the information on this slide. Thank you, and good luck with your project.